All right. Good morning, everybody. Thank you for joining us and welcome to the MercyOne Business Solutions webinar, Behavioral and Mental Health Trends and Updates. We'll go ahead and get started here. It's just after 9 o'clock. So again, thank you all for joining. My name is Colin Sauls. I'm the operations coordinator for the MercyOne Business Solutions team. And again, welcome this morning. All right. I'd also like to thank our speakers on this call today. Dr. Sophia Kang, who is a provider for us here at MercyOne located in Des Moines, who I'll be introducing in just a second, as well as Troy Cook, who will be speaking on the second portion of this presentation today. And Troy is the division director of MercyOne Business Solutions, also located in Des Moines. For some background on Dr. Kang, she is a board certified psychiatrist and educator. She finished her residency program at the University of Arizona, Tucson, where she worked following her residency as faculty, teaching students and medical students and residents. She has been with MercyOne since 2018 and worked in various settings, including inpatient, substance abuse, as well as outpatient clinics. Her interests include understanding the role of trauma and mental illness, incorporating nutrition, physical exercise, mindfulness, and self-compassion, along with medication management and its treatments. Here will be some of the topics that we'll be covering over the next hour or so. Please, throughout this presentation, feel free to utilize the chat space in order to ask any questions. And our speakers will do their best to answer those questions following each of their presentations. And just so that you're aware, this webinar will be recorded and it will be uploaded to our MercyOne Business Solutions webpage within a week or so. And we'll also be sending out a follow-up email after our presentation today with a link that will take you directly to that recording if there's any questions. If there are no other questions for me at the moment, I'll go ahead and turn this over to Dr. Kang.
Oh, she's on mute. You got her on mute.
Oh, thank you, Troy. So I'll be talking about mental health trends that we saw in the last couple of years, especially my own experiences in the clinic. Can everybody hear me okay? Yes, okay, good, excellent. All right, so I'm gonna share my screen here. All right, so I wanted to start out with a quote from Brené Brown. It states, "Vulnerability sounds like truth, feels like courage. Truth and courage are not always comfortable, but they're never weaknesses." And this is something we'll come back to again. But the reason I start with this is this has been my experience seeing patients over the last several years. As far as who was able to embrace this vulnerability, because we were all in this vulnerable position with the unknown virus and dealing with working from home. And
Hi, Dr. Kang. Sorry
Yes.
to interrupt. We
Yes.
just can't quite see your screen.
Oh, can you see it now?
Give it a second.
I'll let it load up in just a second. We're still looking.
Okay.
Or take it out of slideshow mode.
You might have to take it out of your slideshow mode and reshare your screen.
Okay. I'll just take it out of the slideshow. How's that?
It's coming.
There we go. Okay. Thank you very much.
Yes, yes. So this is the quote I was talking about, and I'll probably run in this mode only. So I was talking about how some people were able to embrace the vulnerability and seek help, and others were not able to do so. And that's how I understand, how the trauma of being in the situation we were all in during COVID was dealt with by different people. Some of the main things that was seen during my practice was just worsening of anxiety and depression, especially in younger individuals, and especially at the beginning of COVID in 2019, when it started. And over time, how things sort of stabilized, but still remained a little high. increase in intimate partner violence, increase in child abuse. And the third thing was worsening of pre-existing mental conditions, because people were unable to access their coping skills, which involves social support or being outside, going to work every day. Just because of the lack of that, it worsened pre-existing conditions. I want to just show you a few graphs about the research on worsening of anxiety and depression, really all over the world, and what we see pre-pandemic and the response to that. So all over the world, we noticed that, anxiety and depression were worsening for pretty much everyone. And in this slide, it talks about how the orange part of the graph actually shows right when COVID started, how the anxiety and depression were much worse, and how they sort of stabilized, but sort of remained high towards the next several years. This third graph talks about youth suicide rates in COVID pandemic. And the green line over here shows the increase, the red being the pre-pandemic rates. So this is just to give you an overview of what research has been showing us, as well as, so these slides actually talk about self-reported changes in people's weight, their exercise habits, their insulin use, perceived stress and anxiety during the lockdown. And the third of the bar graphs actually shows you the worst outcomes. So in the first, in figure A, you see weight gain happening during the pandemic. People not exercising as much, more need for insulin, excessive stress, and more anxiety. And the reason I point this out is because our mind and body is connected. Gaining weight, lack of exercise, increased perceived stress is all connected to our mental health. It's not separate from it. Therefore, our physical health affects our mental, and our mental health affects our physical health. And that is what we were seeing over the last several years. So I wanted to give you a paradigm, the way I understand how people cope with stress. And for that, we need to know a little bit about how our nervous system functions. So a part of our nervous system is called the autonomic nervous system, which is what we talk about when we talk about fight, flight responses and freeze responses. It was called autonomic because we thought it was completely automatic and we had absolutely no control over how it functions. But over time, we've realized that we do have some degree of control, like our breathing can help regulate our heart rate and our digestion. So there are two aspects to the autonomic nervous system, the sympathetic and the parasympathetic. Now, if we talk about the sympathetic nervous system, this is the part of our nervous system that gets mobilized when we sense any threat or danger. So if there was, let's say, a fire alarm or some threatening situation, suddenly the blood would go into our limbs so that it can prepare us to either run from it or fight the threat. And our breathing rate would increase, our adrenaline and cortisol would increase. Our hands and feet will become cold because the blood has gone into the limbs now. And it's basically mobilizing us to take care of the situation. Now, the opposite of that is the parasympathetic, which we'll call like a brake paddle. This is what we need if we are in a relaxed state of mind and we are digesting our food, we are accompanied by our loved ones. And, this is when oxytocin and endorphins are being released. And there is a balance of these aspects of nervous system, which goes through our body all the time. So in this next slide, this is the pattern, in this wave form where the sympathetic activates, then it calms down. We sense a threat, we look at the situation and we realize it's not as threatening, and then it calms down. The green line over here shows us if something makes us anxious and we suddenly go on a hyper alert, then we realize, well, it's okay. And then it calms down into a hyper aroused. We get tired after that excessive stress, but then we come back to the rhythm. Now, what we saw during COVID times and lockdown is that people were getting stuck. And this happens with any natural disaster or any kind of trauma, is that people can get stuck in either a hyper arousal state, which is at the top of the graph here, or at a hypo. So when you're at an overactivated state, you're increasingly anxious, your heart rate is always high, there's increased sweating, there's increased sensitivity to loud sounds or any sounds really. And then when you're in a hypoarousal state, you're more fatigued, unable to function, almost frozen, unable to make decisions. So getting stuck here is what we observed as a problem, where people were unable to unstuck themselves, and that can happen under excessive amounts of stress. Now, this slide here actually shows how our brain works. So here are these, there's grazing where they're feeling safe, so they can just function, be in the environment. They don't have to be hypervigilant about anything. But when the deer hears some crackling of branches, or there could be a predator in the surroundings, suddenly he's hyperactivated. And the inner ear muscles of our actually get activated to make sure we are safe. And that's how what I saw with all my anxious patients is that they were very sensitive to all kinds of threat, because the unknown of the situation of how we're going to navigate the virus or other things that were happening around it, including, financial stressors, people losing jobs. There was a lot of unknown, and that made people stuck in this hypervigilant, over anxious state. So when confronted with a situation like that, people cope in many different ways. And these are the three main hierarchy of responses that we see. The first response, which is the most beneficial, is access to a social engagement system, which works through a myelinated aspect of a nerve, vagus nerve especially. But what happens is people realize there's distress, we're unable to sleep, we're having a hard time, we're more irritable, we're going to go seek help. We're going to talk to somebody, or we're going to find a way to navigate stress. And when you access your social engagement, that is when you can sort of find a way to release that stress and function on a day-to-day basis. Even though the stress continues to exist, you found a way to cope with it. However, if people are unable to use the social engagement system, which is very common, especially when someone is struggling with low self-esteem, having difficulty asking for help and sharing what's really going on, then what happens is they go into a more defensive fight-flight tendency, and they become more irritable, unwilling to share what's really going on with them. And the sympathetic system sort of dominates, which is more anxiety and anger. If that also fails, or sometimes there are people who are not prone to being as anxious, but actually more prone to being immobilized or frozen. They actually feel more lethargic and fatigued, and they're actually not able to fulfill their daily activities or groom themselves or function at work. That is another response to a high amount of stress and basically dealing with the unknown. So these are some of the ways that people coped with. And this is where the quote from Brené Brown was relevant, is that accessing our vulnerability, accessing the idea that we're all human and this is an excessive amount of stress that we're dealing with, actually help people engage in the social system, knowing that I can ask for help. So this slide here actually talks about how we all have a zone of tolerance. We all have this ability of how much we can handle. And if we go over that zone and that window of tolerance, we either end up into a hyper-aroused state or we end up in a hypo-aroused state. And again, this is exactly what I saw in my practice, that people had crossed over to the other state, and it was about acknowledging that the stress is excessive and I need to access more coping skills at this time. So some of the things that I work with my patients in my practice is just building blocks of wholeness. And this was very relevant in the last couple of years, is making sure that all the blocks of wholeness were being taken care of, including regulating self-regulation in various ways, taking care of their nutrition, sleep, focusing on having healthy relationship, connecting with nature is something that research has shown has been huge in helping mental health. There's a term called forest bathing, where people, when they hike for hours and spending time in the nature, actually helps their immunity, and their natural K cells, which are one of our immune system, which help us with our immunity, basically, are activated when we connect with the nature. Having fun, movement, exercise is huge in helping us build our immunity and help our mental health, and making sound decision making and wisdom, and also finding some meaning and purpose during this time. I do want to talk a little bit about the younger population and the children. In a family system, or in any system, in a school system, there is a shared nervous system that we share with others. And when the younger individual look at, their leaders and how they're coping with stress, it affects them at another level. So children, actually the young teenage boys and girls, suffered quite a bit when parents were going through stress, and especially when they were not acknowledging the amount of stress they were going through. So children were manifesting symptoms of anxiety and depression during these times. Media and screen time was on an all-time high during this, not just with their school, but people were sleeping with their cell phones, waking up multiple times, more anxious, which is common, but it was much more because they were not able to access their support system in school and be with their friends. Substance use, again, those were some of the coping strategies that a lot of people used, whether it was alcohol, opiates, or cannabis. And what we observed is that as things started to stabilize, their use decreased, but it was still higher than their baseline that they were using prior to the pandemic. Smoking sort of varied, it went up and down, but these were some of the ways people were just coping with the stress. So I wanted to also mention some of the strategies that I found really helpful in my practice, is explaining to patients how I'm prescribing exercise for their mental health. And it's not just for their physical well-being, because it's all connected. And I wanted to mention the study, which there were actually 27 trials on clinically depressed patients. And they found that how endurance exercises and some sort of strength training and being out in the nature was extremely helpful in helping them cope with stress, kind of ground their anxiety and make better decisions. The other thing that was extremely helpful was mindfulness, which is awareness of being in the moment. And on mindfulness, there was an excellent study that was done with a very, let me bring that up. So yes, so this is the study that was done with 5,000 people from 83 different countries. And they had 250,000 data points. What they did was they actually texted all these people in the study and asked them, what are you doing right now? Are you present for it? And how happy are you? And people were supposed to text back and say, this is what I'm doing. I'm driving here, or I'm in this meeting and I'm actually present. And people who were actually present in whatever they were doing, whether it was washing dishes or driving a car, were actually happier than people who were washing dishes, but maybe thinking about a vacation in Hawaii. What they found was you're less happy if your mind is wandering. You're actually happier no matter how difficult the situation is, but if you're present for it, if you're actually present there and not distracted from it. Nutrition is another thing that we focused a lot with our patients, along with other coping strategies for their anxiety and stress, because what we've found is that our gut is connected to our brain, and there's a gut microbiome brain axis which connects the food that you put in your body and how the microorganism, the bacteria in your body actually are talking to your brain all the time. So the more processed the food is, the more sugar there is in it, it is affecting your anxiety levels and the fatigue that you're experiencing constantly. So eating, whole foods and making sure that you're having enough rainbow colors of healthy fruits and vegetables was a huge focus. We talked about an anti-inflammatory diet, which reduces inflammation in the body. And then most of the studies are done on Mediterranean, which is considered to be one of the healthiest diet. And anti-inflammatory was just another form of a Mediterranean diet, essentially. And so this is what they found is, and this is the typical pyramid that I show my patients, is how to plan their meals for the whole week and make sure they have enough, seafood in there, they have enough fresh fruits and vegetables, and minimize some of the sweets and meats and sugars in there. And these are some of the two biggest trials that were done on the Mediterranean style diet. And what they found was they changed the food, especially in children, and were able to get them off a lot of antidepressants by making sure that their diet was more wholesome. And lastly, I want to mention, some of the apps that can be helpful in practicing mindfulness related activities. I'm happy to answer any questions if we have any right now, or I can talk a little bit more about some of the other cases I saw. Colin?
Yes, please feel free to jump in the chat and ask any questions that you may have for Dr. Kang. I can kind of give everybody a minute or so, and if there aren't any, we can continue on and Troy can take over.
Okay.
Hey, Dr. Kang, this is Troy. We had one question that came in, excuse me, on my phone. So apparently somebody was having trouble with that, getting it chatted in. And the question was, with what kinds of issues or potential hurdles are you going to see as people are now going back into full-time work settings and into their office full-time, no longer at home? So I think a little bit around that work from home versus work in the office and what that transition is going to look like from a psychiatry perspective.
Right. So, I saw both ends of the spectrum. I saw people whose anxiety was actually significantly reduced because they were working from home and they actually enjoyed that. And then there was the other end of the spectrum who relied on what we call behavioral activation, which is, getting dressed every day and showing up to work and, just having that routine, which helped them function and stay stable. So what I'm seeing is that a lot of people are enjoying going back to work, and yet there's been a new normal where they got used to working from home, and now it's sort of a difficult transition to get back in the environment as well. But I think a hybrid model is what I've heard most of my patients really enjoy at this time. So it really depends on, how introvert or extrovert a person is, and now they've seen the other side of it, of working from home, and how it involves lesser anxiety for some people who were struggling with that all the time and coping with that. So I think it's really person dependent. And what I'm seeing a lot of places do is more of a hybrid model, understanding that work can be done from home as well, but there needs to be some kind of accountability and people showing up and interacting as well.
Thank you very much. We had another question in the chat here from Wendy. She was curious about whether we are in a new normal regarding mental health status, and if we would see a leveling off or normalization of the previous state as the pandemic subsides. It's a great question. Yes.
I think I agree with that. It is a new normal. And I do think every kind of stress, there is a leveling off that happens at some point. What happens is that there's a new person that we find within ourselves, or a new part of ourselves, which enjoys doing different things because of isolation or all the other factors we were exposed to. And then we integrate that aspect of ourselves into our whole personality. So it's not like we become different people, but we discover aspects of ourselves which become integrated within ourselves. Yes, I can speak about sleep and mental health. Sleep is so huge. So everything that I was talking about, our autonomic nervous system, is really like getting a nervous system reset when we sleep at night. If we haven't had a nervous system reset by having a good sleep at night, what happens is our nervous system is extremely reactive the following day, and we're reacting to things that we wouldn't normally react to. So one of the most important things to improve your sleep would be following a good sleep routine and hygiene. And one of the most effective things, even more better than medications, is cognitive behavioral therapy for insomnia. And I can write that in the chat. It's called CBTI, which is the most evidence-based therapy for insomnia. It's cognitive behavioral therapy. It's about understanding that we need to associate sleep at a certain time in a certain way. And people typically need to decompress for an hour or two before they can actually go to sleep. So thinking that you're doing something extremely active just before sleep, even if it's emotionally intensive, talking to people who can stress you out, watching television, all these things are extremely activating. So eliminating those and actually preparing for a good night's of sleep is what I found lacking sometimes. People think that they can just turn themselves off and go to bed right when they're done, and it doesn't work like that. TV watching is something people think really helps them sleep, but and by research shows that it is not helpful. It's actually really activating for the brain.
Dr. Kang, there was another question in there. For those of us who have had well-controlled pre-existing anxiety disorder before the pandemic and are now experiencing a massive flare, do you recommend anything different than what you spoke about today?
So I think, like I said, incorporating all the other modalities along with it. And, I'm a huge fan of therapy. I mean, if someone is working in therapy, that's wonderful. But if you're not, then considering doing different kinds of therapy, because when someone already has anxiety, these times can be a huge trigger. And when you're triggered by different events, then you want to sort of understand where the triggers are coming from. So, I mean, it depends. If you're asking from a medicinal point of view, then, navigating the medication, getting to the optimum dose. But otherwise, I think working in therapy, and there's a lot of research on many different kinds of trauma-informed therapy these days. Many mindfulness practices. There are actually trainings on mindfulness, which are called mindfulness-based stress reduction or mindfulness-based cognitive therapy. These trainings are about 2 hours for a week, every week for about 10 weeks. And they're extremely helpful in reducing anxiety levels over a period of time, because these are neural circuits that you are building by doing the work rather than, adding a medicine or a supplement in there. So I think these are some helpful techniques to add.
Perfect. Thank you, Dr. Kang. We had another question from outside of the chat. In addition to anxiety and depression increasing during the pandemic, are there any other psychiatric disorders that you saw on the rise or an increase throughout that time?
So in my practice, substance use would definitely be one of those. The substance use was excessive, but again, in my mind, that was a way of people coping with their mental health. Other things like I talked about, people's awareness with violence, whether it was, verbal or physical abuse, some of those things increasing. People who had more of mood disorders like bipolar disorder, when their sleep was getting affected due to, lack of routines and things like that, were definitely having flares of mixed episodes, is what we call them. So yes, I think it affected other disorders as well.
Awesome. Thank you for addressing those. I think that is all we have for questions at the moment.
Okay.
I'll let Troy take over. Thank you very much, Dr. Kang.
Oh, I'm on there. Turn the speakers off. I can. All right. Good morning, everyone. Again, if you're having trouble hearing or there's anything that you can't see, just make sure you put that into the chat and we'll adjust the sound accordingly. I'm going to go ahead and share my screen. Can you see that okay, Colin? Okay, great. All right, so thanks everybody for taking the time today. I really appreciate it. What we want to do for the second part of this, and again, feel free to add any questions to the chat as you think about them as we go. We're happy to continue to address that. But one of the questions that we get quite often when we're talking to employers across our geographic territories that we represent is as well as brokers and consultants, is they always ask us what we're hearing from the marketplace. And when I say marketplace, that includes not just employers and brokers and consultants that we have contact with, but what are we also hearing from other health systems, hospitals, some of our physicians, and a variety of different individuals that contribute to that. Keep in mind that MercyOne is part of Trinity Health, which is a national not-for-profit health system. The beauty of that is it provides us really great resources and information from around the country. So what I did is went to several of those individuals on that particular group that we have contact with, as well as asking the rest of our team, what are some of the trends and things that we're seeing that we can share with you that seem to be helping employers as they address the mental health issues that we have today. The first thing may seem like common sense when it's up there, but unfortunately sometimes doesn't always come out that way. And that is the recognition that one size does not fit all, that there are multiple resources that are needed to really meet the employees along their journey. And I think that the last two words of that are really important, personal journeys, because each of our individuals that we deal with on a regular basis is at a different spot in healthcare. The most successful individuals or companies that we've seen so far in addressing the mental health component of the behavioral health issues have really recognized that it just doesn't take one tool. It just isn't an EAP. It just isn't mental health benefits within your health plan. It's really recognizing that multiple tools, multiple ways to access those tools appear to be getting more success because then people can pick and choose that. Another question that we often get and we often hear is increasing the utilization of an EAP as appropriate. Certainly, EAPs are there for a very specific reason, hence why they're called employee assistance programs. We want to make sure that people utilize them. However, for someone who has a long-term, very difficult psychiatric diagnosis, certainly accessing someone like Dr. Kang is the most appropriate way to treat that. What we have seen and what we've heard from the marketplace and the couple thousand employers that we deal with across the spectrum is connecting EAP education and awareness to general well-being within your benefits. We're seeing that in multiple ways, and I'll address a few examples that we've seen that have been successful. The second is discussing a pathway that EAP utilization to healthcare providers. So in essence, if I start with a counselor in my EAP program and I've exhausted those visits with EAP and I'm still having issues, or if those issues are escalating, how do I successfully then get to a psychiatrist? How do I understand how to coordinate those benefits accordingly? So really a lot of education and awareness around what that transition may look like or that pathway. Another successful strategy we've seen is the timely communication of resources that are available. So all of you know communication is always key. That's not anything new to say. Some of the successes we've heard from EAP providers, from psychiatrists around our systems, as well as employers, is that certain topics are timely. So for example, financial counseling during the tax return season, because people are well aware of any financial stress they may have, or they may be getting a tax return, and understanding how to appropriately allocate those funds and understand what that may look like. Depression and anxiety programs during the holiday season. Dr. Kang can probably tell you that that is one of the highest increases of depression and anxiety is during the months of November and December. There's a lot of family interaction that goes on. There's a lot of things happening that can increase that depression and anxiety. So being able to provide additional resources during that time frame is extremely helpful to the individuals within your plans. So again, just a couple examples of timely communications. The other one that we see as it relates to just total well-being is, for example, we do live in the upper Midwest. It is cold during the winter, and people do in January, February, March get some seasonal affective disorders. So suggestions and ideas on how to cope with that, and then connecting that back to the EAP as other solutions that we've seen. So pretty good ideas. The next one is something that we're seeing on a regular basis, both within the employers that we have wellness and engagement hubs with, and as we talk to employers where we don't do that particular work for them, we're seeing this more often. And that is connecting a wellness or engagement hub and or a benefits administration system with a very prominent link to the EAP resources that are out there. Many times what we've heard from individual employees that come into our system is, I didn't understand how to access my EAP, so I'm looking for a counselor, I'm looking for a psychiatrist, I'm looking for a mental health professional. Obviously, we want to help those individuals, but it's also disheartening to think that they could have had additional resources in some way from their EAP, but a lot of times they don't know where to receive those. So making sure that those things are appropriate. So those are just 4 examples of ideas that we've had given to us across the greater system and across the US. Another thing that we get a lot of questions on are, what are some other programs that we can complement EAP with? Certainly, because people are recognizing point number 1, which is recognition that one size doesn't fit all. Dr. Kang started down this. One of those areas we see a lot of is brain health apps or mental health apps. Now, these are apps that fall short of, quote, diagnosing mental health issues. I would recommend that you don't necessarily have an app diagnose somebody's mental health issue. So we don't want them to necessarily make that diagnostic evaluation through an app. What we want to do is be able to have awareness and education. So one of the things we did, for example, is we connected EM Life to our EAP program that we have with CareBridge. Great example of an additional value. It's really a brain health app that evaluates someone for resources, for programming that may be appropriate to them. Maybe it's some very focused mindfulness programming around yoga, or it may be controlled breathing, things that, again, when you're in the middle of a mental health or a well-being crisis, simple, relatively easy to utilize programming solutions can get someone started back to that road to, quote, normal, what their norm is on how their mental health feels. So those brain health apps, we continue to see a lot of them. We've worked with another one across our systems called Total Brain. So we've integrated a lot of those into the programming that we've done. We continue to see those be a popular option. The other thing that we continue to see a lot of is outside subject matter expertise. So very similar to having Dr. Kang present today. I know you're going to find this shocking, but sometimes employees don't always appreciate everything they get from their employer and the broker and consulting team behind that employer. What we know is that bringing in some outside expertise can provide that opportunity to create some subject matter awareness and education from an outside expert. Doesn't have to be a MercyOne expert. Certainly, we're always going to help you, but anybody who has some expertise in addressing those specific topics, whether it be a video presentation, whether that somebody can watch at their desk, something that's recorded, or something in person. that individuals can go to. Now, one of the things you do have to be careful of is if it's too heavy of a mental health topic, individuals don't want to necessarily go to an in-person presentation because of the potential stigma of mental health. So being aware of that situation is very important. Even though those walls continue to break down in our society and we recognize the diagnosis of mental and behavioral health conditions, we still want to be careful of that as we look about that program. And Colin, feel free to stop me if there's additional. Other things that we're hearing from the marketplace or we're seeing as success. The next is the integration of, quote, well-being into all benefit programming. Really, and we think around education and awareness, as we look at ways to impact an individual, we break it down in really about 3 categories. One is called education and awareness. The second would be behavioral change elements that are less complex. So programs that maybe go beyond just education awareness, they have some actionable steps, but they're kind of more difficult to measure that return on somebody's time and energy. And then we look at very specific evidence-based medical interventions. So again, maybe it's a disease management nurse or a chronic care nurse working with an individual specifically on their diabetes. So as we look at those types of solutions, what we're seeing is a lot of education and awareness campaigns built into benefit programming. So sprinkling in meaningful and logical connections to the programs that an individual may have. So again, I mentioned connecting it earlier to benefits admin systems, an EAP link. We also have seen many employers during this open enrollment period that we just kind of went through. I know a lot of you are July 1 renewals for your benefits or enrollments and obviously annual enrollment meetings. Some of the communications that we've seen during those enrollment presentations, whether they be meetings or they be online presentations that someone can go through, is connecting the dots for people, as I mentioned, so that they understand when to access their EAP, when to access their health insurance benefits and the differentials between them. So explaining that, what the difference of those benefits are, and spending some time on that is a strategy that we've seen from some of our larger employers around the state of Iowa as well as nationally, which seems to be helping that education and awareness so that people can make actionable steps then of how to use that information is the other thing that we've seen. We have a national coalition that we've worked with, and one of the things that we've seen often from that, I'm paraphrasing at the end of this, is here's how to use this information. So thinking about that particular statement as you're communicating has been successful in other areas. Community events to connect team members and outside community resources. I think we all understand that portion of building a culture of people feeling like they're valuable and having good, solid well-being and mental health is to have those connection points with their coworkers. And obviously some people want to be heavily connected to their team members and sometimes they don't, but they still need that connection in some way. So we're seeing a lot more utilization of outside community programming. So for example, I mentioned that I see on there walks and runs and other things that are in your community that your organization could either volunteer at, participate in, or be engaged in. We're seeing a much greater increase in that type of programming from employers. That has had an impact on obviously the culture and the awareness of individuals. It's also a time then when people can network outside of just their team members. They may be able to talk to someone else in the organization they haven't met, etc. Now, we also hear that there's a risk in doing this from employers, that my employees may find a better place to work. And obviously that doesn't mean that it is a better place to work, but there's the perception that that might occur. We would tell you, based upon what we're hearing from employers who've already done these type of heavy community activities, that
employees are already doing that today. They're already looking around, providing additional opportunities for someone to connect into their community or with their coworkers into their community is perceived as a cultural tool by some of our employers that we've been talking with. They like that idea because it does connect them back, because they see the employer helping connect them to the community. One of the other issues that, or one of the other programs that we see quite often is starting to connect to community programming from not-for-profit resources, from really specific entities within your community that can address all levels of health and well-being needs. Now, what that means is that we all know that there are many people that struggle with different aspects of their mental health, their well-being, their nutritional health. Finding resources and giving them choices of where those resources are is important from the surveys we've seen. That doesn't mean that they won't access what you provide as an employer. It doesn't mean that the outside entity is a better access point. It just gives them a choice and gives you the ability to connect individuals to the appropriate resource accordingly. So one such resource that many people in Iowa have been utilizing is a design called Find Help. Now, we have this on our MercyOne website. There are other health systems that have been a part of this as well, and it's really designed to help individuals seek out any community programming and connections they may need. I'm going to try to show you real quick what this looks like. It doesn't cost you anything to send people to this site. It's not something we're trying to sell or push. We just want to make you aware that this is a resource that's out there. Let me stop sharing for a second. Good, Colin. You can see that. Okay. So you can see, if you, for example, if you go to the MercyOne website, it's called Find Help. It used to be known as Aunt Bertha was the back room for this. This is who helps us put this together. So what it basically allows any of your individuals to do is to find all of the different categories, from food to housing to transit. If they're looking for specific daycare, most of us forget that there may be some needs that somebody doesn't want to bring up to their employer. This allows them to do that. So if you simply put in a zip code and put in that I need help with education, it'll load and hopefully it'll let me go to education. It will give somebody the resources that they can tap into appropriately to look for very specific areas around maybe going to school. So in this example, there are 2,281 programs that we could look at. So if I break it down, by financial assistance, so help pay for childcare, help pay for food, a variety of other resources, looking for healthcare, disability benefits. Again, it's designed to be a community resource. We're seeing a excessively high increase in utilization of this particular program right now. Again, it's a co-op program between us. We work with United Ways across our entire system, as well as other healthcare providers, and obviously hundreds and thousands of not-for-profits to make sure, or I'm sorry, hundreds into the thousands of not-for-profits, so that we make sure that we have access to those programs for individuals above and beyond what they may be getting from you as an employer. It's just another resource. We think it's a really good resource. We know that it's getting a lot of traffic out on our website, so we want to make sure that we share that with you as something else we're seeing from employers accordingly. I'm going to pause there and leave time for any additional questions for either Dr. Kang or myself at this point. I'll mute Colin and you can go back on. Oh, here we go. I'll go ahead and answer it. The community resource is, so the one on the MercyOne website goes through our entire geographic footprint, which is Iowa, and then taps into a few counties outside of Iowa and our surrounding states. There is an additional nationwide resource that you can find if you go to Find Help nationally. Find Help is not in every marketplace today, but there are quite a few Find Help resources. The other place to look at that has connected with many of the Find Help websites and is on a community level is the United Ways, or the United Way of the US. Also has a link out on their website to that. And certainly we coordinate with all those not-for-profits to make sure that we're aware of those. We also refer a lot of individuals to those resources that we know that they may be able to access, and sometimes they just don't have awareness. So we often make sure that those are pieces of information that we provide out to anyone that comes in as a patient to any of our clinics or hospitals, as well as through any of our employer benefit programs that we have. Good question. Okay. Yeah, I will be, let me go ahead and get that link while we're talking here, and I'll get it over to you. It won't take me back. Other questions while I'm getting the link loaded? Oh, you bet. Thank you. Any other questions for Dr. Kang that we're not seeing? I'm looking in the Q&A. I don't see anything else in the Q&A. I'll post the link over there too. Check my phone to make sure I'm not getting one on my phone. Okay, I do not. Go ahead and mute me, Colin, if you want.
All right, that will be it for everything today. Just want to thank everybody again for joining. Again, this is recorded, so we will be uploading this to our webpage within about a week or so, and we'll be sending out an email communication. Feel free to email me. My email is on the initial webinar invitation link. So feel free, if you have any further questions or would like any additional resources, just reach out to me, and I'll get you forwarded to the best resource that we have here. So again, thank you everybody for joining us.